Is Get Well 101. In today's live broadcast, as usual, we're going to be talking about health awareness. That's all we do in Gateway 101. And do not forget that in Gateway 101, we do not diagnose or recommend treatment. Okay? We only create healthcare awareness. Okay? Whatever we're saying here does not constitute medical diagnosis, but we only creating a healthcare awareness. That's all what we do. If you are living in this environment, living in metropolitan Atlanta, you find it difficult to get a ride to go for your doctor appointment, please let us know. We will be pleased to provide you assistance. Okay? So we're placing more emphasis on health awareness. Okay? So this does not constitute a medical diagnosis. So we strongly encourage you to seek medical help if you are having any of these symptoms or any of the signs that we're going to be talking about tonight. Okay? Once again, welcome back and stay blessed. In today's live broadcast, we're going to be talking about rheumatoid arthritis. We're going to be talking about rheumatoid arthritis. So, rheumatoid arthritis, RA, is a chronic autoimmune disease that causes the body immune system to mistakenly attack the joint, so leading to inflammation, pain, and progressive joint damage. It is an autoimmune disease that causes the body immune system to mistakenly attack the joint, leading to inflammation, pain, and progressive joint damage. It primarily affects the synovial lining of joint, but can also impact other organs. Rheumatoid arthritis is one of the most common autoimmune joint disease and a major cause of disability worldwide. Key factor: type autoimmune inflammatory arthritis. Tropical onset within the age of 30 to 60, more common in women. Primarily target will be the synovial joint, hands, wrists, and knees. Characteristic features: symmetric joint involvement. So treatment will be corticosteroid, but we strongly encourage you to seek medical help. Like we said, this does not constitute medical diagnosis. In rheumatoid arthritis, the immune system produces auto antibody, most notably rheumatoid factor RF, and the anti-centurion protein antibody that target the synovial membrane. This triggers chronic inflammation, leading to peanut formation, inflamed tissue that invade the cartilage and bone, and over time, irreversible joint destruction. Systemic inflammation can also affect the lungs, heart, and blood vessels. Symptoms and diagnosis: rheumatoid arthritis often begin with morning stiffnesses. So you wake up in the morning, you have your joint is stiff, you have a joint pain. Okay, you feel tired, fatigued, even though you have rested all night, and you notice swelling in a small joint of the hands and feet. As it progresses, joint deformment may develop. So diagnosis relies on clinical examination. That's why we encourage you to seek medical help. Okay, so blood tests for rheumatoid, for RF, and blood tests for ACPA. Elevated ESR or CRP level and imaging such as ultrasound or MRI to assess joint damage. So seek medical help if you are having morning stiffnesses. Seek medical help after you have slept all through the night. You wake up tired and you notice a swelling in a small joints of your hands and feet. Okay. While this does not constitute medical diagnosis, as we keep repeating, we strongly encourage you to seek medical help. So treatment aim to control the inflammation, relieve pain, and prevent joint destruction. Disease modifying drugs might be prescribed by your healthcare provider. Okay, so physical therapy may also be recommended, exercise and smoking cessation complement pathophysiological treatment. But like I said, this does not constitute medical diagnosis or treatment. You have to see your medical provider. Okay? So let me break this down for you in a very layman language. Rheumatoid arthritis is a chronic autoimmune disease. Okay? This means your immune system, whose job is to fight germs, is mistakenly attack your own joints. I repeat again, rheumatoid arthritis in a layman language is a chronic autoimmune disease. That means your immune system, whose job is to fight germs, is mistakenly attack your own joints. Okay, so this leads to swelling, inflammation, pain, and stiffness, damage to joint over time. It usually affects both sides of the body, like both hands or both knees. So what causes rheumatoid arthritis? The exact cause is not fully known, but scientists believe it is a mix of immune system problem. Your body attacks the lining of joint called synovium. It can also be genetics. When we say genetic, it means it might be heredity. So if someone in your family has rheumatoid arthritis, your risk is higher. So what triggered it? This may switch on the disease. That is a switch on the disease. When we say trigger, things that switch on or they switch on the disease, such as infection. If you have an infection, it might trigger rheumatoid arthritis. And if you are smoking, smoking can also trigger rheumatoid arthritis. Stress can also trigger rheumatoid arthritis. Hormonal changes, such as mostly women who are going through cycles, sometimes it triggers rheumatoid arthritis, mostly women of age. Okay, and can it be prevented? There is no guaranteed way to prevent rheumatoid arthritis, but you can lower your risk. Okay, so avoid smoking. One of the biggest risk factor is smoking. So avoid smoking. Eat a healthy anti-inflammatory diet. Stay physically active. Maintain a healthy weight. And manage stress. So simple home remedy to help is rheumatoid arthritis. Like I always said, this does not constitute medical diagnosis or treatment. Okay, this will not cure rheumatoid arthritis, but they can help reduce pain and improve daily life activity. So you can we're talking about home remedies now, okay? Heat therapy, warm shower, heating pad. This help relax stiff joint. Cold therapy, ice pack, reducing swelling and pain. Okay, and gentle exercises, stretching, walking, yoga, keep joint flexible and strong. Okay, anti-inflammatory food, eat more fish rich in omega-3, fruit and vegetables, nuts and seeds. Avoid too much processed food. Avoid sugary drink. Natural support such as talk to a doctor first. You can also take turmeric, which is anti-inflammatory, and also ginger. These are anti-inflammatory that can help naturally. But this will not cure rheumatoid arthritis. This may help alleviate the pain, swelling, and stiffness. And do not forget, I always encourage us to make sure you seek a medical approval before you take any over-the-counter medication. Very important. Do not take over-the-counter medication without medical supervision. Okay, very important. So rest and joint protection can also be of a good home remedy to help alleviate pain. So don't overuse the painful joint. In other words, you're already having pain. Don't go ahead and making it worse by using it. So you can rest. Take a break when needed. Take a rest. Okay. So common symptom of rheumatoid arthritis will be joint pain and swelling. Joint pain and swelling. Morning stiffness lasting more than 30 minutes. Morning stiffness lasting more than 30 minutes. Fatigue, you're feeling tired, feeling very, very tired, even though you have slept all through the night, rested throughout the day. You're consistently feeling tired. This is a common symptom of rheumatoid arthritis. Warm, tender joints, common symptom of rheumatoid arthritis. So when to see a doctor, we strongly encourage you to seek a medical provider. When joint pain lasting more than a few weeks, seek medical help. You have swelling in multiple joints, seek medical help. You're having trouble moving or doing daily tasks, seek medical help. Early treatment is very important to prevent joint damage. Remember, prevention is always better than cure. So let us talk about the early warning sign. Most people, early warning sign. Okay, think of your immune system like a security guide. Okay, rheumatoid arthritis, the guide get confused and start attacking your own joint instead of protecting them. Does that make sense? Let me break this down to layman terms, okay? So think of your immune system like a security guide, because your immune system is to protect you, right? So, but in rheumatoid arthritis, your security system, your immune system, which is now your security guide, get confused and started attacking your own joint instead of protecting them. So this causes inflammation, pain, severe pain, and damage over time. Okay, so there are some early warning signs that most people ignore. So we will be talking about some early warning signs of rheumatoid arthritis. We'll also be talking about food that help and food to avoid if you're having rheumatoid arthritis. Then a simple daily routine for someone living with rheumatoid arthritis. So here is a clear practical guide for living with rheumatoid arthritis, focusing on what people often miss, what to eat, and how to structure your day. Early warning sign most people ignore in rheumatoid arthritis often started slowly. So people mistakenly eat for normal tiredness, normal fatigue, or minor ache. Okay, so warning sign, morning stiffness lasting more than 30 to 60 minutes. If you're having a morning stiffness that is lasting more than 30 to 60 minutes, these are some of the early warning signs of rheumatoid arthritis that people ignore. You're having a small joint pain, your fingers, your wrists, your toes. If you're having a small joint pain, this might be an early warning sign of rheumatoid arthritis. You're having a pain on both sides of the body, both hands, both knees, both legs. This might be an early warning sign of rheumatoid arthritis. Unusual fatigue, feeling drained even after rest. You slept through the night, rested the whole day, and you are consistently feeling tired, feeling drained even after you have rested. This might be an early warning sign of rheumatoid arthritis. Mid swelling with warmth in the joint. Your joint are swollen and warm to touch. Might be an early warning sign of rheumatoid arthritis. Weak grip strength. You have trouble open a can. Anything that is locked, you have trouble opening it. Weak grip strength. Trouble opening a jar. GARS. You're having trouble opening a jar. That is actually a very common warning sign of rheumatoid arthritis that people ignore. Low grade fever or loss of appetite is also a warning sign that most people ignore. So many people ignore this because they come and go, but early treatment can help slow joint damage. Okay, so let's talk about food that help versus food to avoid. Okay, food that help fight inflammation. So this support your body and may reduce flames. Healthy fat, salmon fish, sardines, tuna, but these are rich in omega-3, so they help fight inflammation. Fruits and vegetables such as spinach, kale, broccoli, very rich and they help fight inflammation. Your berries, blueberries, strawberries, they also help fight inflammation. Nuts and seeds, almond, walnut, shea seed, they also help fight inflammation. So these are healthy nuts to take, healthy fruit and vegetable to take, and healthy fat food to take. So healthy oil like olive oil, great anti-inflammatory fat. Yeah, you can take olive oil if you're having rheumatoid arthritis. Very good. It's great in anti-inflammatory fat. Whole grain, brown rice, oat, very good fight inflammation. Turmeric and ginger, those are natural anti-inflammatory effects. Turmeric and ginger have natural anti-inflammatory effects, so they are very, very good. But if you are having rheumatoid arthritis, please avoid food that can worsen inflammation, such as processed and fried food. Fried food and processed food can worsen inflammation. So if you're having rheumatoid arthritis, those are food you want to minimize or totally avoid if you can. So fast food, chips, processed food, fried food, they worsen inflammation. Sugary food and drinks, soda, candy, okay, they worsen your inflammation. So if you're having rheumatoid arthritis, these are some of the things you want to reduce or totally actually avoid. Okay, red and processed meat can also worsen your inflammation. So if you are having rheumatoid arthritis, that's one of the things that you want to pay a very close attention to because they can actually worsen your inflammation. Refined carbs such as white bread, white pasta can also worsen your inflammation. Too much salt can increase swelling. So if you're having rheumatoid arthritis, pay attention to your salt intake because too much salt can increase your swelling. Alcohol in excess can worsen symptoms and interact with medication. So if you're having rheumatoid arthritis, these are some of the things that you want to pay attention to. So let us discuss the simple daily routine for someone with rheumatoid arthritis. This routine helps manage pain, stiffness, and energy. Okay? So, morning, take a warm shower. If you are somebody with rheumatoid arthritis, take warm shower in the morning because this loses stiff joint. If you take a warm shower, you lose it stiff joint. Gentle stretching for 5 to 10 minutes in the morning. It will also help loosen stiff joint. Healthy breakfast such as oatmeal, fruit or eggs, veggies, very good for someone with rheumatoid arthritis. Then if you have a prescribed medication by your primary care physician, please make sure you take it as prescribed. Okay, then midday, light activity, walking or light exercise. Take break, don't overuse your joint. You need a balanced meal, a balanced joint, a balanced lunch, protein, eggs, and whole grain. Then in the afternoon, get a cold pack if joint is swollen. If your joint is swollen, get a cold pack and place on it for 10 to 15 minutes. Okay, do that and repeat it. Don't do tasks in a small session. Avoid strain. Then in the evening, anti-inflammatory diet such as fish, vegetable, healthy fat, optional, warm bath for relaxation, light stretching, relaxation, because this helps losing joint. So at night, get 9 to 10 hours sleep. Keep a consistent bedtime. This helps reduce fatigue. So if you are somebody with rheumatoid arthritis, you want to get a minimal sleep at night, at least 7 to 9 hours of sleep. So extra tip, maintain a healthy weight because obesity will put much pressure on your joint. So maintain a healthy weight. Leg straight on your joint. Avoid smoking. Manage stress. Stress can trigger arthritis, can flare it up. Stay consistent. Small habits matter more than big changes. Okay, so for the sake of you who are just joining us for who are just joining us now, we are talking about rheumatoid arthritis, and we said that rheumatoid arthritis is a chronic autoimmune system disease. That means your immune system, whose job is to fight germs, is mistakenly attacking your own joints. Okay, we also talk about that. So this will lead to swelling, which is inflammation. It will lead to pain and stiffness. We also talk about damage to joint, over time. So it usually affects both sides of the body, like both hands or both knees. So what causes rheumatoid arthritis? I would say that the exact cause is not fully known, but scientists believe it is a mixture of immune system problem. So your body attacks the lining of joint called the synovia. Okay, I also say that it can be genetic. That means it can be hereditary. So if someone in your family has rheumatoid arthritis, your risk is higher. Then we also look at the triggers. What trigger rheumatoid arthritis? I would say that uh, infection can trigger rheumatoid arthritis. Smoking can also is one of the major trigger, and stress can also trigger it. Hormonal changes can also trigger rheumatoid arthritis. Do not forget that rheumatoid arthritis happens mostly between the age of 30s and above, and it's very common with women. So I also look at how can it be prevented. I would say that there is no guarantee way to prevent rheumatoid arthritis, but you can lower your risk if you avoid smoking because smoking is one of the biggest risk factors. Eat a healthy anti-inflammatory diet, stay physically active, and maintain a healthy weight because obesity will put too much pressure on your joint. So manage stress. And look at some simple home remedy to help ease symptoms. I will say that this will not cure rheumatoid arthritis, but they can help reduce pain and improve daily life. So using the heat therapy, warm shower in the morning will help loosen your stiffness. Warm shower in the morning will loosen your joint. So warm shower heating pad help relaxing stiff joint. Then you can use a cold therapy, which is ice pack a swollen joint. Okay, so you need a gentle exercises such as walking, yoga, because this help joint flexible and strong. You also need anti-inflammatory food. So eat food that are rich in omega-3, such as fish, fruit and vegetable, nut and seed. Okay, this will also help. So I will also say that you should avoid a processed food. Avoid too much processed food. Avoid sugary drink, and also avoid uh, too much alcohol. So natural support will be talk to your doctor first. Natural support will be taking turmeric and ginger because these are anti-inflammatory. So rest and joint protection very crucial for rheumatoid arthritis patients. Don't overuse a painful joint. Take break when needed. We also talk about the common symptoms of rheumatoid arthritis. I would say joint pain and swelling, morning stiffness lasting more than 30 minutes, fatigue, feeling very tired, warm, tender joint. I also said when to seek a medical doctor. Who said joint pain lasting more than a few weeks, seek medical help. Swelling in multiple joints, you need to see your doctor. Trouble moving or doing daily tasks, you need to see your medical doctor immediately. Early treatment is very important to prevent joint damage. Okay, so think of your immune system like a security guide. Okay, I'm trying to break it down for you so that you can understand it better. Think of your immune system like a security guide. In rheumatoid arthritis, the guide get confused and start attacking your own joint instead of protecting them. So this causes inflammation. This causes pain and damages over time. Okay? So we also look about some early warning signs that people ignore. Early warning sign that people ignore. Okay, so rheumatoid arthritis He gave you some early warning sign, okay? Because it often started slowly. So people mistake it for a normal tiredness or a minor ache. If you're having morning stiffness lasting longer than 30 to 60 minutes, this might be an early warning sign of rheumatoid arthritis. You have a small joint pain, finger, wrist, toes. First, these are early warning sign of rheumatoid arthritis. You having pain on both sides of your body, both hands, both knees, both legs. These are early warning signs of rheumatoid arthritis. You're having an unusual fatigue, feeling drained, even though you have rested for the whole day. These are early warning signs of rheumatoid arthritis. Mid swelling or warmth in joint. Those are early warning signs of rheumatoid arthritis. If you have a weak, actually, this is very, very common, and you should pay attention to it. If you're having a weak grip, okay, you're having a weak grip strength, you're having trouble. If you're having trouble, open a jar, GARS. If you're having trouble, open a jar or open a can. That is a very, very common warning sign of rheumatoid arthritis. So pay attention. If you're having trouble, open a jar. You cannot hold a jar and open it easily. Having trouble, open it. You can't actually open a drink, a bottle water. If you're having trouble opening a bottle water, that is a very, very common symptom of rheumatoid arthritis. Those are some of the early warning signs we're talking about. So don't take it lightly. Just don't take it one of those things. Go and seek medical help. That is the most common I have seen so far. You can't open a water bottle. Your hand will be shaking. You can't turn it open. Some of the early warning sign of rheumatoid arthritis. No great fever or loss of appetite can also be a warning sign. So many people ignore this because they come and go. But early treatment can show, because early treatment can slow joint damage. Okay? So we also say that you should avoid food that will trigger it. So what are some of the food that will trigger rheumatoid arthritis? Processed food will trigger rheumatoid arthritis. Fried food will trigger rheumatoid arthritis. Sugary sugary food and drink can worsen inflammation. So avoid all this food, or take it it's a bare minimum if you are having rheumatoid arthritis, because this can worsen inflammation. Red and processed meat can also worsen inflammation. Okay, refined carb can also worsen inflammation. So too much sugar, too much salt can increase swelling. Alcohol in excess can worsen symptoms and interrupt with medication. So pay attention to this early warning sign. Why this does not constitute medical diagnosis, as we always said in this program, these are health awareness. Okay, because in Gateway 101, we don't diagnose and we don't recommend treatment. Okay, we can give you a simple home remedy to help alleviate pains. Okay, we can give you a simple home remedy to help reduce symptoms, but we also encourage you to seek proper medical treatment by seeing your doctor. Okay, until we come your way again. This is Gateway 101. Please do not forget to subscribe. Subscribe, because we do come on air almost on daily basis now, creating health awareness. So don't forget to subscribe. Until I come your way again, this is Gateway 101. Thank you for watching and stay blessed. See you.